Hi. Welcome to my channel Health for Seniors. Doctors are shocked. Cardiologist reveals the pill destroying senior hearts. They give it to seniors after surgery. They prescribe it to prevent pain. Pharmacies sell it in giant bottles, cheap, accessible, and trusted for decades. But what if this one pill is silently damaging aging hearts? Cardiologists are speaking out. And what they're revealing is deeply unsettling. In the United States, more than 30 million people over 60 are taking some form of nonsteroidal anti-inflammatory drugs or NSAIDs, many every single day. We're talking about ibuprofen, diclofenac, celecoxib. They're packaged with smiling seniors, labeled arthritis relief and 24-hour pain control. But recent findings suggest something alarming. Certain NSAIDs may increase the risk of heart attacks, strokes, and deadly arrhythmias, especially in older adults, particularly if taken routinely. So why are they still so common? And why are we only hearing about the danger now? It's about the drugs we trust, the warnings doctors were never taught, and the hearts that could be saved with knowledge. This documentary is about the truth. What happens when relief becomes a risk, and the pill meant to help becomes the problem? Let's dig in. The evolution of NSAIDs. Once upon a time, and not that long ago, pain meant rest, heat packs, and grit. But by the 1960s, scientists found a new tool. Nonsteroidal anti-inflammatory drugs, or NSAIDs. Unlike opioids, NSAIDs didn't cause drowsiness. They seemed safe. Drugs like ibuprofen, naproxen, and aspirin quickly became bestsellers. By the 1980s, you could buy them without a prescription, and doctors recommended them for arthritis, swelling, even minor back pain. Then came Celebrex, celecoxib, a selective NSAID that promised maximum joint relief with fewer stomach side effects. Pain, it seemed, had finally met its match. But in labs and medical journals, far from the glossy ads, hidden alerts began to surface. Cardiologist Dr. Mary Satin, case study. Dr. Mary Satin, a board-certified cardiologist practicing in Boston, first grew suspicious of common NSAIDs in 2003, after two of her patients suffered sudden cardiac events within weeks of beginning high-dose naproxen. Both had normal cardiac exams the month prior. No blocked arteries. No signs of inflammation. What both did report: finally feeling better from their joint pain. Fast recovery. Deadly outcome. Dr. Satin began asking, is there something we're all missing? The Vioxx disaster, a turning point. Then came the drug Vioxx, rofecoxib, another COX-2 inhibitor that became wildly successful in the early 2000s, until it was pulled off the market. The reason? It doubled the risk of heart attack and sudden death in long-term users, particularly seniors. That scandal, involving over 38,000 estimated deaths, was a wake-up call. But many existing NSAIDs were left untouched. The truth is, NSAIDs were never tested for long-term cardiovascular safety in older patients with weak vessels, high blood pressure, or kidney decline. They were grandfathered in, long before we understood how inflammation blockers could backfire. So if some of these pills increase heart attack risk by 20 to 50%, why are they still being prescribed? And what exactly are they doing inside the heart? Let's break it down. What NSAIDs do to the heart. The COX enzyme problem. NSAIDs work by inhibiting enzymes called COX-1 and COX-2. These enzymes produce prostaglandins, fat-like substances that cause inflammation and pain. Block COX, no prostaglandins, less pain. Sounds good. But prostaglandins also protect the heart, kidneys, and stomach. They regulate blood flow, keep vessels relaxed, and support nerve function. Lowering them too far? That's when the cost appears. Constriction. With prostaglandins gone, blood vessels constrict. That drives up blood pressure, resistance to blood flow, risk of plaque rupture. A tight artery is one tiny clot away from disaster. Cardiac instability. In weakened or aging hearts, NSAIDs can change electrical signaling, increasing the risk of arrhythmias, irregular heartbeat, atrial fibrillation, linked directly to strokes, sudden cardiac death in vulnerable patients. Real-world data. Meta-analysis from Oxford University. NSAIDs like diclofenac and high-dose ibuprofen increase heart attack risk within 1 week of use. And the risk compounds over time. Seniors using NSAIDs daily for 90-plus days had a 40% increased risk of major cardiovascular events. Harold, 74. Harold had a history of minor osteoarthritis. He disliked strong meds and used ibuprofen regularly for knee pain. He had no prior heart disease, controlled blood pressure, total trust in over-the-counter pills. After 6 months of using ibuprofen daily, combined with occasional Celebrex, he suffered a massive heart attack while gardening. Harold survived, but with permanent heart damage. His only risk? A drug he trusted. So are any of these pills safe? Are certain NSAIDs better than others? And what are the safer options that don't damage the heart? That's next. What you can safely take. Use lowest dose, shortest time. Cardiologists say it clearly: the longer you stay on NSAIDs, the higher the risk, especially after age 60. If you must use them, take minimal effective dose. Never exceed 10 consecutive days without re-evaluation. Avoid combining with blood pressure meds or diuretics unless supervised. List of high-risk NSAIDs: diclofenac, Voltaren, indomethacin, high-dose ibuprofen, 800 mg 3 times per day, celecoxib, Celebrex, and long-term use without cardiac monitoring. Safer options, with doctor-led use: acetaminophen, Tylenol, lower anti-inflammatory action but safer for heart. Topical NSAIDs: Voltaren gel, targeted pain relief with lower systemic load. Turmeric or curcumin, mild but effective anti-inflammatory plant compound. Omega-3 fatty acids, reduce inflammation and protect heart lining. Magnesium plus gentle yoga/stretching. Pain is real, but pain-killing pills aren't the only option. You have choices. Let's reduce joint stress with weight training, posture fixes, and inflammation-fighting food, not just fast pharma. The lifestyle fix for heart-safe pain relief. The anti-inflammatory diet checklist. Reduce processed oils, refined wheat, sugary snacks. Add leafy greens, wild-caught fish, turmeric tea, flaxseed. Safe movement for joint pain. Water aerobics, chair yoga. Eccentric strength training for joint support. Regular lab monitoring. Seniors using any pain med long-term should monitor blood pressure, kidney function, creatinine levels, inflammatory markers. Protecting your heart. Summary. Question long-term NSAID use. Watch for signs: chest tightness, palpitations, breathless walks. Don't wait until something hurts too badly. For years, seniors were told these pills were safe. Today, cardiologists are saying otherwise. It's time we shift the conversation around pain and aging. Because you deserve energy, mobility, and a strong heart, not just temporary relief. If this video helped you, hit subscribe and turn on the bell icon, so you won't miss life-saving info backed by real doctors. Press like to help others uncover the truth. And comment below, have you or someone you know relied on these pills? Stay smart. Stay strong. Your health story isn't over, it's just getting started.